right. First update for my fractured collarbone series. Things to expect. Looks like so. Basically, quick rundown. Crash happened, I think about 10 days ago. It's a Tuesday. Happened a week ago Thursday. So I had surgery 4 days ago. I have the scar to show it, or incision, still pretty fresh. So the first week, very uncomfortable. Man can move around with it's going on. BMX racing in the family, crunching, popping, grinding at my collarbone, super uncomfortable. Very happy with the surgery. Quite a bit of relief, and this is specific to me. I felt surgery was the best route to go for myself. Very happy with the results. On day 4, I started from very late rehab yesterday, so 3 days after. Simple range of motion, isometric contractions, just pushing into a wall to get some muscle contraction. I am out of the sling a little bit. Yesterday I was just maybe a couple hours in the day. Today, most of the day I've been, still morning, approaching noon, so most of the morning I've been out. When we went out to drop my kids off at school, I put my sling back on just because it's moving around. I'm not really strong and don't have much mobility in the shoulder. Still playing it cautious there. So since surgery, things I'm experiencing, also partially because I suffered multiple other injuries. So I did suffer a whiplash and injured my neck or cervical spine. I have quite a bit of tension and soreness in my neck. I did get a nerve block in my neck in the brachial plexus, so they put local anesthetic around a nerve. This numbed the whole front of my chest, which I still have some numbness below the incision. So I don't have much feeling. I get a lot of tingling. I can feel the skin is super tight. I just turned my head to the left. I'm really limited, and it's really, I can feel how tight this skin is versus going to the right. I still feel some tension, but that's partially the fracture, the surgery, cutting through skin, the tension that builds in the skin. The skin starts actually can get glued down to the lower to superficial structures like the surgery site, the collarbone, and the muscles underneath. So working on some skin mobility, whether it's myself or working with a colleague, therapist, will be beneficial down the road. Just ultimately protecting the area still, being reasonable expectations. A few daily activities like basically being able to pour a bowl of cereal if possible today, first day, 4 days. But I still can't reach up into a cupboard. I can't lift anything that's over a few pounds. So I still can't lay on it. Although sleeping has become much more comfortable. I'm off medications. I was given several medications, some opiate-based pain medication, which I don't really love, but I did take a couple times just when pain was in between the anti-inflammatory I was given. So I was able to not get into a lot of pain because for the first few days after surgery, pain can be quite high. Once I'm off, I don't need medication. I haven't taken any anti-inflammatories today. Don't have any of the burning, aching pain, just kind of tension and a little bit of a small ache if I over move my shoulder beyond its limits or grab something a little heavy. But I'm being very careful to avoid those kind of things. Yeah. So that's where I'm at. I want to show you where I'm at with my motion and what I can do. So you'll probably see a massive mess around me. I've been trying to fix BMX bikes, and I'm not even strong enough to lift bikes off the ground and hang them up in the bike room, which is next to my home gym. Big mess. I don't have the physical capability of cleaning up. Simply my shoulder motion. Forward is the most challenging. You can see there are some pain starts in my shoulder. Right there's are all I have. Going back, then you consider my comp. So you see the differences, what I'm capable of. My non-injured side, going up to the side, that's literally my limit. And then external rotation, you can see this is coming along nice. And I do think I suffered some level of injury to my glenohumeral joint in the crash, and then going behind my back for internal rotation. And you can see the difference. In my right's usually more mobile because I've injured my left shoulder a number of times. I've had multiple subluxations or partial dislocations in each shoulder. But I do suspect I suffered, whether it's a contusion or it's a rotator cuff injury, or did suffer another subluxation when I crashed, because the force was so high, and I had a lot of pain through my collateral shoulder deltoid area, and over the spinal scapula and into my medial border of my scapula, in between my shoulder blades. Still have a lot of tension and soreness there, so there's definitely some soft tissue injuries around that are limiting me as well. So yeah, let's get. I'll show you a few things I'm working on for range of motion. Instead of using a stick, which is common, I don't even know what my dowel is. I like using a wall is fine, and I like to shift back. And this is passive range of motion, just allowing my shoulder to not have to use its own muscles to work its way up. I go to a point of tension, so I feel tension all in the front. I do have some affected, as I mentioned, some sensation affected from the surgery and the nerve block still. So I'm playing it safe, not going super aggressive with it. So as you can see, I'm able to get not even half range until I get quite a bit of tension and discomfort. Okay, that was the surgeon's office calling. Set my follow-up appointment in 2 weeks. So expect to follow up with the surgeon every. So yeah, the external rotation is simply using this. It's moving my body, going to a point of mild discomfort, not a lot. So a little bit of tension to feel all in front of the shoulder. Yeah. Other options, using a dowel. These are quite popular as well. Holding up, and then you just use. I find this. I tend to try to use my arm more, where it's. And then easy to do the external rotation version of this, like that. So pick what you have available, and even trying to go back. This one actually feels pretty good. I like the stretch sensation. I guess not really uncomfortable. So I usually do these approximately 10 reps, or just until like if it feels kind of sore or kind of stretch. If it starts to increase in intensity, I drop back. I don't want to aggravate tissues that are not ready for anymore. Yeah, so movement is actually pretty good. It's amazing how much improvement you can see. And you can even see how was that? Kind of similar, maybe a little more. Yeah, but that's definitely improved. And even with that, I can tell my reaching behind my back with internal rotation has improved. So yeah, there, and then some simple isometrics. So some simple isometrics is simply pushing external rotation, just in neutral, pushing out, allowing to feel tension but not pain. Internal, or external, no internal. Pushing forward. This is the most comfortable. I feel like there's impact, or the impact has left some soft tissue in the front of my shoulder. Pushing back. This is when I like pull my shoulder blade back and down. Get not just the root deltoid, but also get the rhomboid traps working. Think about a function movement like a row. Kind of fun. So you can rotate through, like you can go to the side. Yeah, so there's one round about 10 seconds each. Feeling pretty similar. I'll do another couple rounds once I turn the camera off to keep working along on that. So yeah, that's kind of all I'm doing right now. I don't want to aggravate or piss it off and have to take days to let it recover. Try to around safe environments around the house, have it out. Some daily activities. I've already focused on my grip strength. Returning, I can open a doorknob, I'll brush my teeth, and I can get my hand up a little bit. So a little bit by a little bit. Surgery, you don't always see progress that you expect with training. It can be really, really slow at times for a few days, few weeks, or sometimes you can make big jumps because once basically your nervous system kind of relaxes, says, "Hey, it's okay, let's go." It's whether it's the threat has been removed because of pain, stiffness, whatever, or other stresses in your life or stresses as part of the injury. You can suddenly see it's like you see range of motion, like massive improvement with just one session or one treatment. Um, so and it's different for everybody. Sometimes it takes a little longer. Some people happen pretty quick. Sometimes something as simple as a hot pack or ice pack or something can change the equation for your body. You can see some significant changes. So yeah, that's a little bit. 4 days. I'm pleased where I'm at. You may see something similar or not after your surgery if you get surgery. Typically, if you don't get surgery, you don't see quite as quick results. I was literally barely out of the sling for a week after my injury, but mine was like multiple fragments, comminuted fracture. Some people have more simple fracture that line up, might see more, but because it's not fixated with a plate and screws, you might see slower results, at least initially, until the bone starts to calcify. Because you do have to respect physiological healing times when you don't have a bone that's fixated. Because like that bone, like the clavicle, the collarbone is the only bony connection to your shoulder girdle to your body. Otherwise, the shoulder girdle floats with muscles controlling it. Hence why there's so many chronic problems with shoulders. So don't feel the need to rush and potentially risk a non-union fracture if you're not having surgery, or even if you do have surgery. Play it by listen to your professionals you're working with on when to push, when not to. Listen to your body. Pain is a good guide. Pain is there for a reason. Soreness, discomfort is expected, but respect it. Your body knows what's going on with itself, and when your body's ready, it'll let you know. You'll be able to make progress. I can guarantee it. I've worked with thousands of injuries. Things eventually improve, even though it's not always linear.